Why did you bring me here, Em?
Ma, I just want to get some fresh air and see some clouds. I had such a great time being a child with you, and even until now. I think it is also time for me to spend some time with you.
How dear it is seeing you here, Em. Even my own children can come.
Ma, but it's been a while now, and I still can't believe that you can be this strong. Even though you knew about your cancer, to your therapist, and all the experience you've had, you are more than what I imagined to be.
From your words, it seems I'm already lying, huh? Em, you see, I've come to this point in my life where I'll appreciate everything. I've planned my life already, and I am thankful for living so long.
But Ma, wait, I'll have to show you something. Look, look, this is how you will look after you're done with your chemo. How do you like it?
You've grown so much. I'm so thankful and so proud of you. I don't even need to finish my treatment. What I need is someone to be here with me.
But Ma, you see, I am so grateful for you. Taking care of you for the past few months have been hard for me. But you have shown me how precious each member of the family is. Would you let me stay with you for a little bit longer? I promise to take care of you and be with you till then. Ma?
Who is it?
It is your naughty grandchild, Ma.
Have you eaten, Em?
Ma, how about you come to our home? I'll make you breakfast. Let's go home, Ma.
When I take picture of my children I love the most, I can think of one. But if I can choose someone that I'll stay with, it's your mom. Because you're there. Because you're there, my Em. Because you're there. I don't think I can go on living like this. I want to be free already.
What do you mean by that?
My youngest son can keep the house. Whichever left will be given to my eldest son.
I've already taken note of it. How about your daughter and her son?
I have nothing left to give, attorney. I have a good life already. Whatever happens to me, just tell them to let me be.
Tell whom? The doctors? What about your family?
I've taken too much of their time taking care of me when they could have lived a better life. So I don't need them to know. Please, attorney, just keep it between us. I want them to have a good life without me.
I'll keep in contact with your doctor.
Ma, can you feel my hand? Ma, can you hear me? Please hold on a little bit longer. Even though I know about your directives and other instructions, even if I can't understand, even if I receive nothing, I will always be here beside you. Please hold on a little bit longer. I love you so much, Ma. You are my number one.
Advance directives provided Ma with the opportunity to express her wishes for her medical treatment as well as the end-of-life care.
Advance directives honor the dignity of choosing quality over the mere prolongation of life.
These patients lie silently in the final stages of cancer, able to speak or express their wishes. It becomes clear. This is exactly why some prepared the advance directive. In those carefully chosen words, they had already shared how they wanted their final moments to unfold. Peaceful, free from machines or any tools. The healthcare team, on the other hand, was not just to give medical interventions, but to honor this deeply personal choice, ensuring dignity guides and at their journey.
In that quiet moment with the attorney, Ma's voice trembled with the truth she had carried for so long, her yearning to be free. The do not resuscitate wasn't just a legal form. It was her way of saying she was ready to let go. It became clear then, to me, that this was her act of acceptance. She was choosing to release the burden of a life that had become more about pain than joy, seeking the peace she so deeply deserved.
Some patients cannot make decisions for themselves. As the dementia slowly took hold, it became painfully clear. There would come a time when decisions would no longer be hers to make. In that moment of realization, the weight of her advance directive hit with full force. It wasn't just a form. It was her voice for the days when she could no longer speak. With a trembling hand, she understood that this DNR wasn't about giving up. It was about choosing peace, sparing her loved ones the agony of uncertainty, and ensuring her care would be guided by love and not fear.
Advance directives and do not resuscitate or DNR stops ineffective resuscitation efforts for terminally ill patients.
As I watched the play unfold, a profound realization struck me about the fragility of life and the power of our choices, not only to cancer patients, but it can also apply to patients who suffered a severe brain injury and fell into a coma, leaving the medical team grappling with the weight of their decisions. This shows the importance of advance directives and do not resuscitate or DNR orders. They are not just legal documents, they are declarations of our values and our desires. In the face of uncertainty, they provide clarity and peace, allowing us to maintain control over our final moments. Let's engage in these conversations now, ensuring that our wishes are known and respected so our loved ones won't have to bear the burden of making these choices alone.
As Ma sits with M, crafting her advance directives, it hits her. The weight of this moment isn't about the end, but about the life she's lived. Every decision, every word on that paper becomes a reflection of a journey filled with love, laughter, and even heartache. In M's quiet presence, Ma's heart swells with gratitude, realizing that this act isn't just about preparing for the inevitable. It's about honoring a life so beautifully intertwined with those she loved.
Do not resuscitate relieves family from pain and making urgent decisions.
Do not resuscitate allows for a peaceful death while maintaining the patient's dignity.
Advance directives guarantee that the patient's choices, like do not resuscitate, are respected even if they cannot voice it out.
Strive not to be successful, but rather to be of value. A day of awakening and seeking the value of ourselves. Speaking with hope is John Benedict Fernando Lumen, going over the fortress, breaking the prophecy. As the truth unfolds, yearning for knowledge became eager. Advance directives and do not resuscitate orders will now be presented by my group. Let the voyage sail, as we will now start this tale. The waves direct ourselves to advance directives. Unfamiliar of advance directives? Let me tell you something. Well, advance directives pertain to legal documents that provide instructed medical care of a person when they are incapable of decision making or unable to communicate effectively their desires in end-of-life circumstances. It is actually consulted with the respective healthcare provider and the family, ensuring the individual's rights are upheld. It is recommended to be planned when still in good health, as it essentially gives the optimum capacity to be precise. And well, ample time is needed to have reconsiderations without the pressure of dealing with an illness.
The value of life lies in how we choose to live it, even when choices seem impossible. Speaking with Hope is Nashifa M. Palahuddin, and now we are going to talk about the living will. So there are two types of advance directives, the living will and the power of attorney. So the living will, it is a document that provides information on the kind of care an individual wishes to receive in accordance with their values when they are unable to advocate for their own health care. So this means that when a person cannot communicate their preferences due to illness or incapacity, their living will serves as a guide for healthcare providers and family members. And in the Philippines, there are specific requirements that must be satisfied to effectively carry out a living will. For the document to be legally effective, the following conditions must be met. The client must be a minimum of 18 years old. The document must have the signature of the individual making the living will, and it must be signed in the presence of two qualified witnesses or a notary public.
Life's true value lies in the moments we give and receive love, in the resilience we show, and in the purpose we find each day. Speaking with Hope is Eliza Edelweiss E.S. Calderon. The second type of advance directives is power of attorney. The power of attorney is a legal document that requires the appointment of a third party or a proxy to make the decision on behalf of the individual who is incapable of making the decision themselves. The individual or client is the principal, while the appointed person is called the agent. Anyone of legal age can be appointed as the agent. In most cases, it is the spouse or any family member designated to grant or withhold approval for the medical treatment, as healthcare providers often turn to the patient's next of kin or a close friend to act as the default decision maker. The principal passes on the specific details of care preferences, and the agent is obligated to honor the principal's wishes.
Life is not measured by the breaths we take, but by the moments that take our breath away. Speaking with Hope is Valerie RU, and we will talk about living will versus power of attorney. The living will, in its essence, outlines the individual's healthcare preferences to be carried out. In comparison to the power of attorney, another individual deciding with consideration of the principal's best interest is the fundamental requisite of the legal document. Hence, it brings focus not on the specific decisions of the principal, but rather on the decision making.
In life's unpredictable journey, there's one thing that can bring clarity amidst uncertainty: advanced care planning. Speaking with Hope is Roshan Sanel C. Perez. Advanced directives can be beneficial for the individual, the healthcare provider, and their family. It can aid the individual with the medical treatment and interventions they desire that is favorable to their wants and aligns to their beliefs and values in the event that the individual is in a critical condition, in a coma, in the latter stages of dementia, or is terminally ill. Planning ahead of time prevents unnecessary interventions and suffering, and it spares the family or caregivers from making heavy decisions during bereaved times. Advanced directives also provide clear instructions on the type of care a patient wants or does not want. This clarity helps healthcare providers make decisions that align with the patient's wishes. These documents can be created by adults of any age, not just the elderly, since unanticipated situations pertaining to death might arise at any time. Most importantly, this gives the patient autonomy, especially when they are unable to speak for themselves. Remember that advanced care planning is not just about your future health. It's about ensuring that your voice is heard when you need it most.
Hesitations will only lead to regrets. Do it while you're still capable. Speaking with Hope is Danielle R. Gonzalez. Considerations in making the advance directives. Living will. A minimum of 2 healthcare providers must determine that the patient is incapable of making medical decisions and that their condition is either a terminal illness or a permanent state of coma before it can be utilized.
The best way to predict your future is to create it. Speaking with Hope is Sofia Nerjay Biludin. There are considerations in making advance directives such as the power of attorney. The patient's incapacity to make decisions must be first certified by a physician. Next, the person nominated by the patient will have discussions with the healthcare team, following the patient's directions when making decisions.
Now, with a clear understanding of advanced directives, we can now turn our attention to the topic of Do Not Resuscitate or DNR orders, which further discusses an individual's wishes regarding medical interventions in critical situations. Life teaches us to make good use of time.
while time teaches us the value of life. Speaking with Hope is Raihana Jawad, and I will delve into the topic of Do Not Resuscitate Order. A Do Not Resuscitate or DNR order is sometimes called Allow Natural Death or A&D order. This is a legal document that indicates a person's wishes not to receive cardiopulmonary resuscitation or CPR in the event of a cardiac or respiratory arrest. Healthcare workers may still attempt to save the patient's life by providing treatments such as medications and oxygen, so long as they do not perform CPR. Patients who choose to have a DNR typically have a terminal illness or other serious medical conditions where their chances of survival are low. In most cases, a healthcare provider writes a DNR order after discussing the benefits and risks of CPR with the patient. This process empowers patients to make their own choices about healthcare and end-of-life treatment, ensuring that their wishes are respected. So rather than staying in a continuous state of pain, they now prioritize comfort and quality of life, which means that the patient's care shifts towards palliative care. This is a specialized medical care that focuses on providing relief from pain and other symptoms of a serious illness. So ultimately, a DNR is a critical aspect of advanced care planning, ensuring that the patient receives care that aligns with their true values and preferences at the end of life.
The purpose of life is not to be happy. It is to be useful, to be honorable, to be compassionate, to have it make some difference that you have lived and lived well. Speaking with Hope is Eunice Miro. Now, we move on to the benefits and risks of DNR. The benefits of a DNR order include reduced invasive treatments, respect for patient autonomy, and emotional and psychological relief for the patient. However, there are also risks, such as emotional distress for families, potential regrets, or second thoughts, and possible legal and ethical dilemmas. A DNR order can provide significant benefits, including minimizing the use of invasive or painful treatments, which can help patients experience a more peaceful end-of-life process. It also respects patient autonomy by honoring their wishes, giving them control over their medical care. However, the DNR order comes with risk, such as causing emotional distress or guilt for family members, possibly leading to second thoughts or regrets and creating complex legal and ethical issues for healthcare providers and families alike.
To truly value life is to embrace the power of choice. Speaking with Hope is Fatima Ayesha J. Sabi. When considering a do not resuscitate DNR order, patients and their families must evaluate the benefits and risks of cardiopulmonary resuscitation or CPR in relation to the patient's health status, including any comorbidities and prior treatment responses.